If you take a step back and look at the modern healthcare system honestly, and I mean really honestly, a pretty uncomfortable question appears. Why are so many people spending more money on healthcare than ever before, taking more medication than ever before, seeing more doctors than ever before, and yet becoming sicker earlier, becoming heavier earlier, more dependent earlier than any previous generation? Why do millions of people in their 50s already take multiple medications a day for blood pressure and cholesterol and reflux and pain and sleep and anxiety and diabetes, often several of these at once, and still feel older than their parents or grandparents did at the same age? Why do hospitals overflow? Why do GP waiting lists grow to months and months? Why do pharmacies expand into every high street and the NHS budget increase year after year? While at the same time, by almost every population level measure, actual health, continues to decline. Well, the answer, when you look at it clearly, is that modern medicine was never built to create health. It was built to rescue collapse. And when you design an entire system around rescuing collapse, you inevitably create a world that waits for collapse to happen before it does anything. That is what I'm calling the health Ponzi scheme. Not a conspiracy, not malicious intent from any individual necessarily, just incentives, structures, habits, and economics quietly producing exactly the outcome they were designed to produce. So for most of human history, medicine fought acute threats, what we call short-term threats, like infections or trauma, accidents, complications of childbirth, pneumonia, broken bones, appendicitis. And it became extraordinary at this. We developed antibiotics and, got really good at surgery, anesthesia, emergency care, intensive care. If you arrived critically ill in 1920, your chances were pretty poor. They weren't very good. If you arrive critically ill now, then there is a really good chance that medicine saves your life. And that is genuinely one of humanity's greatest achievements and something that we need to be really proud of as a society. I've worked in emergency medicine for 10 years, so I can tell you we can do amazing things to save somebody's life. But at some point, this battlefield changed and medicine didn't fully change with it. Because today, the biggest killers aren't infections or accidents or childbirth. They are heart disease and strokes and diabetes and, kidney failure, dementia, obesity-related cancers, fatty liver disease. These are slow burn diseases. They develop very quietly over 10, 20 or 30 years, driven by the way people live, not by an infection that arrived a couple of days ago. And the really uncomfortable truth here is that a system that's been built and optimized to deal with emergencies is really, really poorly designed to prevent slow, gradual, lifestyle-driven decline. The skills are completely different, the timescales are different, and the economics are also completely different. Now, most people seem to believe that their healthcare system is continuously protecting them, continuously monitoring them, catching things early. And I guess to some degree it is, but the honest picture is that for most people, the system is largely waiting for something to cross a threshold before it acts. You are fine until your blood sugar becomes diabetic. You are fine until your blood pressure becomes high enough to warrant medication. You are fine until your kidney function falls below a certain number. You are fine until your chest pain starts, until you develop angina. You are fine essentially until you become symptomatic enough to justify investigation. Now, that is not a criticism of individual doctors. It is how the system must operate when time is short, budgets are finite, and demand is basically endless these days. Doctors work with guidelines and thresholds and triage, and that structure exists for pretty good reason, but biologically, disease begins long before any threshold. Atherosclerosis, which is the furring of the arteries that causes heart attacks, can start decades before a cardiac event. Insulin resistance can exist years before a diabetes diagnosis. Loss of muscle begins from the early 30s onwards. Visceral fat, the fat that wraps around your organs, accumulates very silently, and by the time the red light comes on, the engine has often been overheating for decades and decades. The system catches the crisis. It was never really designed to catch what comes before it. But this is just the system that we've been trained in. There's a really good way of thinking about this, and it's a bit like debt, like monetary debt. The way that borrowing against your future feels quite painless in the moment, but it can become quite catastrophic later. Well, health works in the same way, and I think about this quite a lot. Every year of sedentary living and poor sleep and excess ultra-processed food and low muscle mass and repeated glucose spikes and alcohol and social isolation, every year is a small loan taken from your future self. At first, the repayments are invisible. You still feel okay, you still function, perfectly normally. You still go to work, you still more or less feel like yourself. But the interest starts compounding. You need more caffeine to get through the afternoon. You recover slower after a bad night's sleep. Your weight goes on more easily and it comes off less easily. Your blood pressure starts to creep up. Your energy drops in a way that feels different from just sort of being tired. Your joints start to ache. And then one day, the bill arrives and you get diabetes. You're diagnosed with heart disease or atrial fibrillation, or you have a stroke, or you have kidney function decline. And at that point, modern medicine often helps you service the debt rather than erase it. The medications manage the consequences. The stents prop open the arteries. The dialysis does the work that the kidneys can no longer do. Now, all of that is real and valuable, and I am grateful, obviously, that this exists, but it's not the same as never accumulating the debt in the first place. And the tragedy here, the world that we live in, is that most of this was preventable. Not by doing anything extreme, not by buying lots of supplements, but by making small deposits into the right account consistently for long enough. One of the most dangerous things that I hear said again and again is that it's just aging, inverted commas, and it gets used constantly by patients, by families, and sometimes by doctors under pressure as well, as a way of explaining things that are not necessarily inevitable at all. Now, some aging obviously is real and irreversible, of course it is, but a significant proportion of what we call aging in Western populations is not biological aging. It is just accumulated dysfunction. Compare two 70-year-olds for a second. So one walks briskly every day. They lift weights. They have a sharp mind. They live independently. They take no regular medication. Another 70-year-old struggles on their stairs. They feel fatigued most of the time. They take 6 prescription medications. They have poor balance. They've developed metabolic syndrome. They have the same chronological age, but completely different biological ages. And the research really backs this up repeatedly. We've got the Harvard alumni studies, we've got the UK Biobank data, dozens of large cohort studies, all showing that active, leaner, fitter populations maintain function dramatically longer and die from fewer chronic diseases at a much later stage of life. Age is partly time, but a very large part of it is how the system has been treated across that time. The person who ends up on 6 medications at the age of 70 didn't get unlucky in most cases, and I say this with genuine compassion and not judgment at all. Most people get there by a long series of small decisions. None of them felt significant at the time, but they just compounded across decades in the wrong direction. And look, people ask me all the time, well, why doesn't my doctor tell me any of this? Well, sometimes they do. There are many excellent doctors that try. And I want to be clear that the problem here is not the people working in the system, many of whom are obviously brilliant and fantastic and dedicated and working under enormous pressure. But just think practically about what a GP appointment actually looks like. They have 10 minutes if you're lucky. And a big part of that is actually bringing you into the room, documenting, examining. So they probably have 5 minutes with you, 5 minutes of decent time. And in that time, they need to review your symptoms, assess for anything dangerous, prescribe things safely, work within the clinical guidelines, and document everything for legal and audit purposes. They need to coordinate referrals. They need to manage whatever complexity that you walk in with. How on earth can you practice medicine and diagnose and treat and listen to you properly in 5 or 10 minutes? It is a ridiculous system that we work in. There is genuinely not room in that encounter for a deep conversation about your sleep, about resistance training, about insulin resistance, about protein intake or metabolic flexibility and the psychology of behavior change. And beyond time, the system pays really heavily for prescriptions and procedures. It pays very poorly for prevention. A surgeon who performs a bypass gets reimbursed substantially. A GP who spends 40 minutes helping somebody restructure their lifestyle and avoid that bypass in the first place gets pretty much nothing for that extra time. That is just how the incentive structure was built in this healthcare system, and these systems produce what they reward. The system rewards treating disease, so that is largely what it does. Now, as you know, in these videos, I always try and give you at least one good bit of advice. And if there's one thing that acts as the opposite of biological debt, one asset that compounds in your favor over time, the research points pretty clearly towards muscle. Muscle stores glucose and improves your insulin sensitivity, which protects against diabetes and all of the chronic diseases that underpins. It supports your bone density and it protects against fractures. It preserves balance and reduces falls. It maintains a higher metabolic rate. It acts as a reserve during a serious illness. We know that patients with more muscle mass survive critical illnesses significantly better than those without. Low muscle mass is a really powerful predictor of frailty and loss of independence and hospitalization and mortality. Now, technically, if you look at the longevity literature really carefully, cardiorespiratory fitness, your VO2 max, your aerobic capacity, is probably the single strongest predictor of how long you live. That is what the data says, and I want to be really honest about that. But here is why I think building muscle is the thing that I would tell most people to focus on first. And it's not really about the muscle itself. What I've noticed, just from my own experience, and what makes sort of intuitive sense when you think about it, is that when people start lifting weights and resistance training and they start getting stronger and they start seeing and feeling a difference in their body, it tends to trigger a cascade of other changes that they never really planned for. Their step count goes up because they feel stronger and more capable, and walking just feels easier. Their diet improves because they want to get more protein in and they're invested in the results. And that investment spills over into other food choices. Their social life often improves because they're going to a gym very often and talking to people, or they're feeling more confident and more willing to go out, or they just feel better about themselves in a way that makes them want to be seen. The act of building muscle, and I don't mean visibly looking big, I just mean sort of feeling stronger and making your muscles more efficient. If you do this consistently, it has a remarkable tendency to pull other good habits in behind it, like a domino effect. It is the keystone habit that unlocks all of the others. And that is why, even though VO2 max technically wins in the research, I would recommend to most people to start building muscle first. So the obvious question for this video is, how on earth do you get out of this health Ponzi scheme then? Well, you don't fix the system by waiting for it to fix itself. You have to exit it personally. And the way you exit this is by building assets instead of debt consistently over a long period of time. The things that function as health assets are not glamorous. They are not new. They are pretty boring, actually. They are not exciting, and they are not supplements that people try to sell you. They are very simply daily movement and walking after meals, resistance training regularly, aerobic fitness maintained across decades, a diet built around whole foods and high protein and plenty of fiber, and not much that comes in a packet with 15 ingredients. Consistent sleep as well at consistent times. This is really, really important for your health. A healthy waistline as well, maintained over years, blood markers that get checked annually so that small shifts get caught while there's still time to act. For example, like your HbA1c. Strong relationships as well, and genuine social connection. And also a sense of purpose, something to get up for. And this is really important for anybody past retirement age, something that requires you to plan and show up and then engage. None of these really are that surprising, but all of them are really powerful. They are all mentioned in the research, and they all compound exactly like interest does, which means the earlier you start, the more dramatic the effect, and the later you leave it, the harder the work becomes. But it is never too late to begin compounding in the right direction. And let me just leave you with this. So modern medicine is amazing when a catastrophe strikes. I work in emergency medicine. I deal with emergencies all the time. If you rupture an appendix, or you develop sepsis, or you have a stroke, or you arrive in cardiac arrest, you want modern medicine immediately, and you should be deeply grateful it exists. I am very grateful that I am able to work in this. I've seen what it can do, and it is extraordinary. But if you want to avoid becoming the person who needs it repeatedly, who is on 6 medications at the age of 60 or 50, who is attending multiple appointments every month, who has lost their independence before they should have, well, all of that work happens upstream. It happens in kitchens and on pavements and in the gym and in bedrooms when you sleep, and in the decision to go for a walk after eating, and in the choice to lift something heavy a few times a week. The greatest health mistake that most people make is believing that the healthcare system creates health. Well, the truth is that modern healthcare restores health sometimes. It preserves health sometimes. It can manage some level of decline, but it doesn't create health. You have to create health. Daily life creates health. Habits that are repeated very quietly across years create health. And if you understand that early enough, like really fully understand what I'm saying in this video, rather than just sort of nodding away and saying you'll start tomorrow or next week or next year, well, you stop living reactively. You stop waiting for that red line. You start making the small deposits that compound into something really remarkable in 20 or 30 years' time. And that is how you beat this health Ponzi scheme.